Before we get into PSA screening, I noticed that one thing that's causing people to want to go get their PSAs checked with their doctor is if they have any blood in their urine and they're looking for prostate cancer symptoms. So is blood in the urine a prostate cancer symptom?
So the official name for that is hematuria, and blood in the urine is a fairly common occurrence, and in my experience, very, very rarely is it related to prostate cancer per se. And as a prostate cancer physician, the most common reason that I would see hematuria in a prostate cancer patient is because they had previous radiation to the prostate. And so as a secondary effect from radiation, it's not an uncommon problem. But there are a number of other issues that can occur in people whether they've had prostate cancer or not. Kidney stones, bladder cancer, prostatitis. Those are all far more likely causes of blood in the urine. And it's nice that this topic came up because I've been touting a new urine test to try and tell if the cause of the blood comes from bladder cancer. So people undergo screening for various cancers as they get older in their 50s and 60s for colon cancer. If they've been smokers, we do scans of their lungs. And every year during the annual physical exam, men should have a urine analysis, women too. And if any blood is detected, that could signal an underlying bladder cancer that's lurking in the bladder that needs treatment, could be cured if it's caught at an early stage. Historically, that's required a visit to the urologist for a cystoscopy, which is a scope threaded up the penis to look and make sure there's no bladder cancer, which is kind of an unpleasant process. If you have to do it, you have to do it. But there's a new urine test out called CXbladder that is very accurate. This urine test can be a substitute for a cystoscopy. CXbladder will not tell you if there's a kidney stone present. That would take a scan. And then prostatitis is more a diagnosis made by the physician. Is there any discomfort with urination or fever or something of that nature? But the idea of just doing a cystoscopy for everyone that has blood in their urine, which historically has been required for men in the past, now can be circumvented with this new urine test called CXbladder.
Thank you for mentioning that.
Yeah, so that's a nice way to avoid something that's kind of unpleasant, and occasionally it has complications. When people have an instruments threaded up in their body, and sometimes they'll get some scar tissue afterwards, or get an infection from that, and it's nice that can be safely avoided now.
Wow, awesome. Thank you so much for watching. If you have questions you would like us to ask our prostate cancer experts, you can go ahead and email us at info@pcri.org. And we have a ton of information on our website as well, so go ahead and visit that. And if you enjoyed this video, please give us a thumbs up and click the subscribe button. This helps other prostate cancer patients learn about our channel on the YouTube platform. We hope you have a great week.